Navigating the diverse landscape of learning differences can be a profound journey of understanding and empowerment. In this presentation, we will explore the nuances of attention deficit hyperactivity disorder, ADHD, and autism spectrum disorder, ASD, shedding light on their unique characteristics, treatment approaches, and the importance of tailored support for individuals affected by these conditions. Attention deficit hyperactivity disorder, ADHD, is a neurodevelopmental disorder commonly diagnosed in childhood, characterized by pronounced hyperactivity, impulsivity, and difficulties maintaining concentration. These symptoms can significantly impact an individual's academic, social, and professional functioning. Individuals with ADHD often experience comorbid conditions such as major depressive disorder, bipolar disorder, substance use disorder, obsessive-compulsive disorder, and oppositional defiant disorder. The presence of these comorbidities can directly influence the therapeutic management and medication choices for ADHD patients. Stimulant medications such as dextroamphetamine and methylphenidate have a paradoxical effect on individuals with ADHD, serving to calm and focus them rather than overstimulate. These medications work by facilitating dopaminergic and noradrenergic neurotransmission in the prefrontal cortex, leading to improved attention, concentration, and executive functioning. Individuals with ADHD often contend with comorbid conditions such as major depressive disorder, bipolar disorder, substance use disorder, obsessive-compulsive disorder, and oppositional defiant disorder. These accompanying conditions can significantly influence the therapeutic management and medication choices for individuals with ADHD. Addressing these comorbidities alongside ADHD is essential for providing comprehensive and effective treatment. A multidisciplinary approach involving mental health professionals, therapists, and medical providers is crucial to ensure the best possible outcomes for individuals with ADHD and their associated comorbidities. Considering the presence of comorbid conditions is vital in ADHD treatment, as managing these conditions directly impacts the effectiveness of ADHD interventions. Tailored treatment plans that account for the unique needs of each individual are key to achieving optimal results. The self-medication hypothesis suggests that adolescents with undiagnosed ADHD may turn to substances like cocaine, amphetamines, and other stimulants to alleviate their symptoms. These substances can mimic the action of ADHD medications by increasing dopamine levels in the brain's reward center. While children and adolescents with ADHD typically respond well to stimulant medications, adults with ADHD who are treated with stimulants face an increased risk of developing substance use disorder. This risk underscores the importance of considering non-stimulant options such as atomoxetine for managing ADHD in adults. Early recognition and treatment of ADHD can play a crucial role in preventing the development of substance use disorders. Individuals with undiagnosed or untreated ADHD may resort to illicit drugs as a form of self-medication, highlighting the significance of timely intervention and support. Stimulant medications such as dextroamphetamine and methylphenidate exhibit a paradoxical effect in individuals with ADHD, contrary to their stimulating nature in neurotypical individuals. Instead of causing overstimulation, these medications serve to calm and enhance focus. The mechanism of action involves facilitating dopaminergic and noradrenergic neurotransmission specifically within the prefrontal cortex. This neurological modulation results in improvements in attention, concentration, and overall executive functioning. By calming and sharpening focus, ADHD medications effectively mitigate symptoms of hyperactivity and impulsivity. This enables individuals to more effectively engage in relevant tasks and activities, ultimately enhancing their daily functioning and quality of life. Stimulant medications such as dextroamphetamine and methylphenidate exhibit a paradoxical effect in individuals with ADHD, contrary to their stimulating nature in neurotypical individuals. Instead of causing overstimulation, these medications serve to calm and enhance focus. The mechanism of action involves facilitating dopaminergic and noradrenergic neurotransmission specifically within the prefrontal cortex. This neurological modulation results in improvements in attention, concentration, and overall executive functioning. By calming and sharpening focus, ADHD medications effectively mitigate symptoms of hyperactivity and impulsivity. This enables individuals to more effectively engage in relevant tasks and activities, ultimately enhancing their daily functioning and quality of life. Stimulant medications such as dextroamphetamine and methylphenidate are typically the go-to treatment for ADHD due to their proven effectiveness in enhancing attention, concentration, and executive function. However, it's essential to tread carefully with individuals who have a history of substance use disorder, as these medications pose a risk of abuse and addiction. For adults grappling with ADHD, non-stimulant options like atomoxetine and modafinil may be preferable due to their lower risk of substance abuse. Atomoxetine functions by bolstering norepinephrine levels, while modafinil's precise mechanism of action remains somewhat elusive. Despite this, modafinil has demonstrated efficacy in addressing conditions such as narcolepsy and daytime sleepiness. Autism spectrum disorder, ASD, encompasses a broad spectrum of neurodevelopmental conditions, including autism, Asperger's syndrome, childhood disintegrative disorder, and pervasive developmental disorder not otherwise specified, PDD-NOS. Typically, ASD is diagnosed around 3 to 4 years of age when core symptoms like deficits in social interaction and communication, along with restricted and repetitive behaviors, become more prominent during this developmental period. Treatment for ASD primarily revolves around therapeutic behavioral intervention programs. These programs include speech, language, and occupational therapy, along with social skills remediation services. The goal of these tailored interventions is to address the unique needs and challenges faced by individuals on the autism spectrum, fostering their development and enhancing their quality of life. Autism spectrum disorder, ASD, presents with core symptoms including deficits in social interaction and communication, alongside restricted and repetitive behaviors. These challenges significantly affect individuals' social navigation and relationship building abilities. Typically diagnosed around 3 to 4 years old, ASD symptoms become more pronounced during this developmental stage, emphasizing the importance of early identification and intervention for tailored support. Treatment for ASD primarily involves therapeutic behavioral intervention programs encompassing speech, language, and occupational therapy, along with social skills remediation services. These personalized approaches aim to address the unique challenges individuals with ASD encounter, promoting their development and enhancing their social interactions and overall well-being. Early recognition and diagnosis of ADHD and ASD during developmental stages are pivotal for timely intervention and support, mitigating potential long-term impacts on academic, social, and emotional well-being. Initiating early intervention programs, including speech, language, and occupational therapy, along with social skills remediation services, proves highly effective in catering to the distinctive needs of individuals with ADHD and ASD. These tailored approaches foster growth, enhance functioning, and elevate overall quality of life. Moreover, early identification and treatment of ADHD and ASD contribute to preventing the onset of comorbid conditions like substance use disorders, depression, and anxiety. By addressing core symptoms and challenges promptly, early intervention lays the foundation for a more positive life trajectory. Acknowledging the unique strengths and talents of individuals with ADHD and ASD, such as heightened creativity, attention to detail, and problem-solving abilities, is fundamental to embracing neurodiversity. By doing so, We honor the diverse perspectives and valuable contributions these individuals bring to our communities. Establishing inclusive and supportive environments tailored to the needs of individuals with ADHD and ASD is paramount. This entails offering accommodations, fostering understanding, and promoting acceptance, thus enabling these individuals to flourish and realize their full potential. Through recognizing the distinct strengths and capabilities of individuals with ADHD and ASD and providing them with the requisite support and opportunities, we empower them to pursue their aspirations and make meaningful contributions to society. Exploring the intricacies of ADHD and ASD allows us to gain profound insights into the distinct challenges and strengths associated with these neurodevelopmental disorders. This understanding is pivotal for offering effective support and interventions tailored to individual needs. Customizing treatment approaches based on factors like comorbidities and personal preferences is vital for optimizing outcomes. Adopting a multidisciplinary holistic approach enables us to address the multifaceted needs of individuals impacted by ADHD and ASD comprehensively. By honoring the unique perspectives and contributions of individuals with ADHD and ASD and fostering inclusive environments that empower them, we can foster a more diverse, dynamic, and enriched society. Embracing neurodiversity unleashes the full potential of those affected by learning differences, leading to greater inclusivity and societal enrichment.